As we mark World Health Day today, some experts, many experts in fact, say South Africa's public healthcare system needs urgent government intervention. The call comes on the back of a 2-year pandemic as it exposed the dire state of our health facilities. It was also exacerbated by the fire at Charlotte Maxeke Academic Hospital now almost a year ago, which has also put hospitals under immense pressure. To unpack this further, we're now joined by Professor Mmampapatla Ramokgopa, who is the head of Orthopaedic Surgery at Chris Hani Baragwanath Hospital. Prof, it's great to have you with us on the program this morning. And it's a big question, isn't it? On this World Health Day, what is the state of our government facilities? What would you reply to that, Prof?
Yeah, thank you very much, Michelle, for inviting us. And also thank you and greetings to all the viewers. Yes, indeed, this is a very important day, a landmark, in celebrating some of the successes in healthcare, environment, but not also that, but also to highlight, some of the difficulties that healthcare workers are experiencing, not only in South Africa, but the world over. And indeed, the world has, over the years, moved in terms of ensuring that health matters are being taken care of. And one can track back right from the time when we made very important decisions at Alma Ata on the primary health care. And following that, then there was the 2000, Millennium Developmental Goals. And of course, followed shortly by the 2015 Sustainable Developmental Goals. All of them, when you look at them, you realize that issues such as poverty, decent health care and decent living environment and so forth, all those were at the center because everyone realized that indeed for the sustainable, life for both of us and the planet, that it was very important that we've got a healthy, people, that are on this planet. So indeed, want to appreciate the leadership of the World Health Organization, the United Nations, for them, having come up with some of these themes to highlight, the problems and also to direct, countries and individuals as to what direction to follow.
Yeah,
and we say all this in the background, we've just had, all these upheavals, different, healthcare facilities where there were protests about the state of care in the hospitals, not just large hospitals, but even the smaller hospitals. Indeed, the state of healthcare, it is on the decline. It is deteriorating. It is a concern. And this calls upon, it is a message. It sends a message, to the leadership in this country, political and otherwise, and across all political, divisions, to say that if we do not take care of this very important aspect of life, then things are really going to go west. And we can see clearly already, there have been lots of, media coverage, of some of our fellow, continental citizens, leaving their countries, from either Zimbabwe, Botswana, Mozambique and elsewhere, coming, for what they consider to be a better health care in South Africa. That is a message that needs to be sent to SADC leadership, to South African leadership, political and otherwise, to say that if we do not stand up, open our eyes and ears to the deterioration of this sector, that things are really going to go very bad. And that is our concern. And, what has been happening around Charlotte, Hani Bara, Helen Joseph, it is all, a representation of what is happening elsewhere. And we are very concerned.
Prof. Ramokgopa, what I was going to ask you is, the questions around our healthcare system and how it performed over the past 2 years of the pandemic after wave after wave of new COVID-19 infections. And it wasn't a challenge that was unique to South Africa. We saw healthcare systems and hospitals around the world with the same challenges. Do you think that actually we held up quite well during those difficult periods, or is that not accurate?
I think we did. I think we acquitted ourselves very well. And when you want to think about it, this was one of the worst, pandemics, that ourselves and the world has ever experienced. We've never experienced something like this before, but the devastation was there for all of us to see. It was not only a country such as ourselves, we've got lots of people that live in poverty, but also rich countries were hard hit. And in our systems here, our systems were tested to the limit. The one thing that it showed with the South African systems is that, in a sense, the foundations, had been established, and that made us to be able to withstand, the difficulty. But not only that, we had everyone, people across political lines, coming together to face the pandemic. And I tell you, that was a winner. And this is the message and one of the important lessons that our people need to get very clear that with regard to health, it cuts across political lines. It is not something that you can use as a political tool, but it calls upon each and everyone, to stand up and do his bit. Now, more so, the response from government, it was encouraging at that time. Perhaps this was the main focus. As much as it exposed, the weak areas, it also showed us that with commitment, with resilience, that indeed we can win. And somehow we want everyone, government and everyone, to draw lessons from this, that it cannot be a situation of us and them, but it must be a question of all of us on the same boat, trying to do the best, deliver equitable health care for all our people.
Yeah.
Problems that we had around staff shortages, they were clearly exposed. And when we added those few numbers, it showed that indeed there was a positive response. And for that, we really want to take our heads off for the government. And now we are saying that is why we resisted, when, they wanted to withdraw those bodies. But the other thing that we also need to pay attention to is that now this is an opportunity for us to look at all other areas where we are weak, including the infrastructure, the management of these facilities, the supply, issues. All those things are very important. Just overnight at Baragwanath Hospital last night, or over the past couple of days, we had, out of 5, only 1 autoclave working. So we had a number of patients cancel, we couldn't go in, and including very sick children, severely injured people. We had situations where we did not have linen. Those situations are unacceptable. The same with consumables. We still have shortages of the very basic consumables. Now the point is, where is leadership? And that leadership, indeed, it has shown that we are weak as far as that. We need a leadership that will be able to rise up, to these issues, both at the local and national level. And people must be working together. The local, the province, the national must be able to monitor situations, know as to exactly what is happening on a daily, not once off. When people say there's no break, then you send people with cameras to go to the kitchen to take photographs and so forth. If that is the way of monitoring, then it must be done on a daily basis. Because once we say there is a problem, that already is the flashlight, is the red light, which means that there are some fundamental problems here that needs to be attended to. Yes, our systems have been severely shaken by COVID-19 pandemic. We've been tested to the limit, and out there's clear information that indeed there are areas where we are lacking. And if we do not attend to that, the situation that we see with our fellow compatriots from this continent moving from their own countries to come and seek for help here, it is going to happen to us here. And unfortunately, it's only going to be the rich that will be able to fly out to Paris and London to get health care.
Yeah,
so we need to attend to these issues. Otherwise, our planet, our country, and our people are going to continue to suffer.
Professor Mmampapatla Ramokgopa, let me thank you for your time this morning, and everything that you're saying, of course, evidenced by the kind of coverage that we've seen, particularly in Gauteng, of the struggles in our healthcare sector over the past couple of weeks. He's the head of orthopedic surgery at Hani Baragwanath, as we look at the state of our healthcare facilities on this World Health Day today.